Hi everybody. Mental health and mood disorders, better known as also as well as affective disorders, which are commonly seen in depression, like severe depression, bipolar. Now, depression, the symptoms of worthless, feeling sad, feeling like the abilities of difficulty functioning with normal day-to-day activities, normal day-to-day living, how that affects you, affects within yourself, affects your thoughts, how you're thinking, your behaviours there, your feelings and your emotions. And it's also seen in bipolar as well, mania. Now the manic side of bipolar is the the high side of things, like having less needed, more energy, high self-esteem, not needing to sleep as much, your behavior, functioning, your behavior, how it affects your behavior, like doing abnormal behaviours that you wouldn't normally do, like going out and spending. Say a lot of people with bipolar may go out spending money, going out buying things that they don't really want. They may not even have enough money there to do, but the behaviours there of doing things you wouldn't normally do. And then you've got the low side of the bipolar as well, like the depression side of things. You know, sometimes the manic is there and then along comes, it can coincide together, the depression side of things. So the mood's there, the mood disorders there with the depression and the bipolar. But it's also seen as well in schizoaffective disorder, which is a combination of schizophrenia, symptoms of schizophrenia, and the mania is a combination there which affects again the disorder, like the functioning of day-to-day living, and also as well with the mood disorder as well, feeling irritable, agitated, maybe feeling angry, anxious, anxiety there. It's all a combination there, like with the mood disorder there. Now, it's something, so it's created, is separate, it's like a mood disorder, how it affects you within yourself, like with your thoughts, your feelings, your emotions there. Maybe not everybody will get that mood disorder with their symptoms of their mental health, but it's something that will not just go away on its own. It needs treatment, and the quicker really the treatment there, the better for the recovery from it, to help with it. But not all the time. Someone may recognise that or recognise it, because sometimes it can affect your what's the word, like connecting with other people, like having difficulty engaging and so forth, like that. So it's all about really the treatment. So the treatments for it, to start off with, the first line of treatments is medication. Now, that in itself, getting medication for it, is getting the right medication that's going to suit you, the individual, because you know there's many different types of medication, and one may suit one person and not another person. Getting the right dosage of medication. So it's all about seeing somebody, getting professional help, like seeking that help from the doctor with all these sort of things at first to start off with. because some medications have side effects to them. So that you've got the medication, and alongside as well, you have to have, like, there's other treatments as well, like psychotherapy. Psychotherapy is a form of talking therapy, like your CBTs. So it coincides, so you have that treatment with that treatment to help it, so it bangs off of it, so it works better with it. You know, because the mood disorder, I don't think they really know what's caused it, what causes it. You know, they say the brain, like a chemical, the balance there, the receptors, the signal, what goes like from the brain, how it's the balance there and so forth. But you know, whether they know what really is causing it, I don't know. But a lot of the time people are given medication with mental health problems because they say a chemical imbalance, but I will question mark that there. So yeah, so the medication and the psychotherapy, the talking therapies will help you to, like, with the ability to be able to start coping with it, processing it, going, like, learning, giving the headspace to deal with what is going on within yourself, because obviously it's going to affect your feelings and your emotions, how your behaviours. So it's all like with the talking therapies there, like learning to adapt, learning to, like, the ability to be able to function in a better way and to cope with it in a better way. You know, it's all about practice. It takes time. Many people have to have long-term periods of treatment, but the better the treatment, the more better that you'll be able to start learning to cope with it and to overcome it. Eventually, it's like a journey in itself. But as well, it's like, after, you know, alongside with that talking therapy and so forth, and your medications and so forth, it's learning as well yourself, like your self-help to cope with these sort of things as well. You know, having that, like I say in all my videos on mental health, a routine is very important. Like the self-help for it as well is, because a lot of the time you may lack in the motivation, you know, like how the mood disorder is affecting you. So it's like building back that motivation in movement. Movement is very important in itself for mental health, and it will help with the mood in itself, the mood disorder in itself. The exercise will be very good, because the mood disorder is built around so many different things, like the stress, the anxiety, feeling irritable, maybe anger, you know, anything that's how it's affected, like triggers can affect it as well, certain triggers. So exercise will help alleviate those symptoms. As well, you may find like having difficulty like with sleeping or not getting enough sleep. It's all about getting that balance there with the sleep. So trying to get into a routine of getting a better sleep, because sleep is important, rest is important for it too. So getting that balance there, right balance of a better routine with your sleep, because your sleep might be all over the place, and that in itself will won't make things any better with the mood disorder. Because how do we feel anyway? How does anybody feel anyway if you've lacked in sleep? You feel irritable. Anybody could feel irritable and angry, and sometimes if you're not getting that much sleep, you can feel disorientated and and how it affects your thinking and so forth. So getting that right amount of sleep, you know, everybody's different on the amount of sleep that they need, but getting an important like routine in a proper like pattern of getting that right sleep, maybe trying to go to bed at a certain time at night and try sticking with that, and getting up at the same time every morning. You know, these things take time. You know, it do take a bit of time, because if your sleep's all over the place, it's not going to work overnight. It's going to take a bit of time to do it. So maybe, you know, if you're having that difficulty getting up in the morning because you haven't had enough sleep, maybe getting an alarm clock to get you back on track with that right amount of sleep that you can get. Plus as well, there's another thing as well, is eating healthy, your proper diet, because if your physical health, it'll help you physically, then it can help with your mood. If you're just supposing, like, if your certain foods can affect your mood and so forth, make you feel how it makes you feel within yourself, it can affect you physically as well. All these symptoms, it can affect you physically, like within yourself as well. So getting a right, healthy, balanced diet, like eating, making sure breakfast, whatever you have for your breakfast, dinner, like lunch, and then dinner. So 3 meals a day. They say 3 meals a day is important, but making sure you have some nutrition in with your food as well to help with all that. So food is the right, like, healthy, like, nutrition. That's very important as well for us physically and for us mentally. So that will help with it too as well. But it's all about, like, and as well, like with the talking therapies, you will start to be able to, like, that, you know, all these things take a bit of time. Got to give yourself time to heal, because eventually you will start to be able to overcome it and be able to cope better with it, with these mood disorders that affect your day-to-day living. You'll be able to start to live a normal life, be able to cope with your day-to-day living a lot better with it all. So it all takes time, you know, and the more you do these things, the better you'll see these benefits. With the talking therapy as well, you'll start to be able to engage a bit more better, like connect, like conversating a bit better, being able to cope a bit better with it, giving you that headspace. There's another tip as well, to write down when your mood triggers come along. Write it down as well. Write down how it makes you feel. Write down what you're getting, what those symptoms are. Write it down onto paper, and then you'll be able, once you see it on paper, you'll be able to process it better, in a better way, in a more calmer way. Like mindfulness, practicing that mindfulness towards yourself, like being mindful, and start to be more, start to be non-judgmental towards yourself, start to feel a bit more kinder towards yourself. Start, like, with the mindfulness, it helps you feel more, to get more kinder towards yourself, and it helps you to, gives you the ability to be able to cope with your feelings and emotions and those thoughts in a better way. So that can, the combination of all that will help with your mood disorder that you may have. But your first initial step to get you going, to be able to cope with it in the long run, is to get that first initial treatment, is to seek out, seeing the doctor, and then go from there. Because eventually you will start to see benefits from it all as well. So I'm going to end the video there. I hope you like this video. Please share, because it's very important, because many people may have these problems and may not even realise that how serious or what it actually, what it is, what's going on with them. So it's very important to get that first initial help for it, to help you for the future, to help you to be able to cope with your day-to-day living as well. So I'm going to end the video there. Don't forget to give us a like, and see you in the next video.